Before deciding if PRP treatment is right for your injury, Dr. Goyle conducts a thorough exam and screening of your medical history. The day of the procedure, you will check in 30 minutes prior to fill out the designated forms. We ask that all patients fast for 6 hours prior to the procedure and come in properly hydrated.
Hi, my name is Mark Leverett. I'm from Reno, Nevada, and I flew down here to Phoenix to get PRP injections done on my knees by Dr. Goyle. I hurt my knee in my late teens racing motocross. Approximately 3 years later, I had surgery on my knee to repair or remove the meniscus. I'm not sure exactly what. I've never been right since then. I can't run, I can't play tennis. Later in life, I hurt my left knee mountain biking, which all I can do physically fit is ride bicycles, again, because I can't run because of the pounding. So I'm hoping that Dr. Goyle is going to bring some of this back where I can play tennis with my girlfriend, and maybe even run would be kind of nice. My right knee that I had surgery on, if I hike or again play tennis, or even if I attempted to run, I would suffer for a week just with major pain.
After your paperwork is completed, Dr. Goyle will answer any last questions you may have before our amazing medical team escorts you to the exam.
Today with Mark Leverett, 57-year-old gentleman with history of bilateral knee pain. He's lived a very active and athletic lifestyle, racing cars and just living life to the fullest. And in the process, his knees have taken a beating. Have you had surgery on your knees before, Mark?
My right knee, yes.
Yeah, meniscus?
Meniscus,
Yeah, how long ago was
I
that?
believe inner and outer is what they said.
Okay, so
1988.
Okay, so it's been quite a while. So today I'm going to do an ultrasound examination of your knees and kind of get an idea of what's going on as far as the pathology.
Okay.
And our plan today is to treat the knees with PRP. So PRP is platelet-rich plasma. So that's where I'll take your blood, spin it down in a centrifuge, and concentrate all the anti-inflammatory and growth factors. And then we'll re-inject it into each knee to ideally reduce the osteoarthritic pain.
Okay.
Okay? I'll talk you through every step, and yeah, we'll just see what we find here.
Dr. Goyle will perform an ultrasound exam on the injured area to confirm his plan for treatment. He will go over the treatment plan with you and answer any questions that you may have. Once all of your questions have been answered, it's time to get you prepped for your procedure. You will be escorted into our relaxation room where one of our nurses or Dr. Goyle will perform a standard blood draw. When the blood is collected, it is placed in our state-of-the-art centrifuge to be spun down. This process takes about 20 to 30 minutes to complete. After the blood is done spinning, Dr. Goyle removes the plasma from the machine and extracts the platelet-rich plasma into several syringes. From there, Dr. Goyle will get the treatment area cleaned and prepped for your injections. He sterilizes and properly drapes the treatment area before performing any procedure. Using ultrasound technology to guide him, Dr. Goyle injects the platelet-rich plasma into the designated area. This can be uncomfortable. Please note that local numbing is available upon request. Dr. Goyle finishes the procedure by placing Band-Aids over the treatment area.
Okay, Mr. Lever, you did really great with the procedure. Everything went fantastic. You know, with this procedure, your pain might get worse before it gets better. So usually for a week or so, there might be an inflammatory reaction. So your pain might increase. Just take it easy.
Okay.
1 week, no working out your legs, no riding your bicycle or anything like that. Okay. Next weekend, you can hit it hard. That's tolerated. Okay.
All right.
Do all your knee exercises. I'll give you these braces to remind you to stabilize your knee for the next week. Okay.
Dr. Goyle will send you home with the proper durable medical equipment to help support the area.
Emailed you the post-procedure instructions.
Okay.
Try to follow those the best you can. You want to avoid anti-inflammatories, no ice for the next week. We have dietary recommendations too, so we like you to adhere to an anti-inflammatory diet, so avoiding processed foods, avoiding sugar if you can, limit alcohol intake, caffeine intake as well for the next 4 to 6 weeks, just to optimize the results here, okay? And then just take it easy for the next week, and then the week after you can start your activities as tolerated. So mountain biking, hiking, running, weightlifting, all that stuff.
Okay, thank you.
I made a physical therapy referral for you. So for this next week, just take it easy. Next weekend, you can start mountain biking, hiking, lifting weights, and all that kind of stuff. The following Monday, I want you to start physical therapy. That's really key to the rehabilitation and the outcome of this procedure, okay?
Okay.
And then you've got all the post-procedure guidelines as far as dietary recommendations.
Yes.
And then we'll follow up by telephone every 2 to 4 weeks, every 2 weeks for the next 4 to 6 weeks. And then we'll talk about maybe doing a round 2 if we have to.
Okay.
Okay, that would be
Okay.
about the 2-month mark. Hey, Mark, you did great.
Thank
Hope
you.
get some really
Thank
great
you. That
relief
was
with this.
awesome.
Okay, I'm a phone call away if you need me.
Okay, you made that a lot easier than I
Right
thought it
on.
was going to be.
Awesome.
Thank you.
Go get better.
It was a lot easier than I expected it would be.
So the pain on a scale of 1 to 10 was probably about 5, but that was only from the initial poke of the needle, and then from then on you didn't really feel anything.
For further questions regarding this procedure, please visit our website or give our front desk a call.